Good morning once again. Thank you so much for your interest in the Exploring Healthcare program, which is an online international exchange program and training program for future healthcare professionals. The dates of the program are March 12th through the 18th, 2023. And my name is Lina Yamashita, and I'm the director of the Exploring Healthcare program. I have been at VIA for about 5 years, and most of my time has been spent working with medical students. And before COVID, all of our programs, including the Exploring Healthcare program, was held in person. But with COVID, we've shifted to virtual. And I've been really amazed by the high quality of engagement that can happen virtually. And so if you're considering the program, I hope that what I will share later will excite you enough to apply for it. In terms of my own background, I'm very committed to international education. I am Japanese, but I spent a lot of my life not only in Japan, but also in the Philippines and in Singapore. And I've spent almost 20 years in the United States now. But my passion is always working with international students and fostering their personal growth. So that's a little bit about me. So VIA is a nonprofit organization, or NPO, that was founded in 1963. And we began by sending American students to Asia for different service learning projects. And then in 1977, we started bringing Asian students to the US. And so since 1977, we've done bilateral, meaning sending Americans to Asia and then also bringing Asian students to the US. And now we are an independent nonprofit organization. So we're separate from Stanford now, and we offer experiential learning programs both in person and online in Asia and Silicon Valley. And we have 8 current staff members. All of us are remote, and we're based all over California, from San Francisco to LA or Los Angeles. We have many alumni all around the world, over 10,000 from 27 nationalities, primarily from the United States, East and Southeast Asia. And we are dedicated to offering global exchange programs, both in person in the US, Indonesia, Japan, Myanmar, Thailand, and Vietnam, and online. So that's a little bit about VIA. And in case you're wondering, VIA used to stand for Volunteers in Asia. And it's because historically we sent American volunteers to Asia to volunteer in Asia. But we now do more than that. We also bring Asians to the US and do many more things. So we decided to just call ourselves VIA. Now I want to tell you a little bit about the program, Exploring Healthcare. So as I mentioned at the very beginning, it's a cross-cultural exchange program for future healthcare professionals who are interested in exploring issues related to culture, society, diversity, and innovation in the context of healthcare. The program started in 1996 in collaboration with Tokyo Women's Medical University and Tokyo Medical University. So we're celebrating 26 years in 2023. So it has a long history, preceding my time at VIA as well. And during that time, we have had over 800 students join from all around the world, studying a broad range of healthcare disciplines. Most of our students are studying medicine, but we have had participants from nursing, pharmacy, dentistry, public health, and other fields too. And as I mentioned earlier, with COVID, we have had to do all of our programs virtually, but we will resume in-person programs next summer, so in August 2023. But we have learned a lot from the online program. So moving forward, we are planning to offer one virtual program, at least one virtual program each year and one in person. So that's a little bit of an update. So now I want to share a little bit about the learning objectives of the Exploring Healthcare program. And there are 5 of them. So the first is to critically examine different healthcare systems. So during the program, we will learn primarily about healthcare systems in the US. But because participants come from different backgrounds in different countries, you'll have opportunities to compare and contrast and learn from each other the different healthcare systems that exist in the world. Another objective of the program is for participants to gain insights from a wide range of healthcare professionals. During the program, you'll meet not only physicians, but also nurses, social workers, chaplains, people who provide spiritual care, mental health professionals, and other professionals as well. We will also discuss the intersections of healthcare and social issues. So although the program is focused on healthcare, we use healthcare as a lens to explore a variety of social and cultural issues that you might not necessarily learn about in school. Another objective is to explore unique medical issues faced by patients from diverse backgrounds, especially in the United States, and especially in the San Francisco Bay Area, where I am based. We have patients from all different, we have not only patients, but people from all different backgrounds. And so this program is an opportunity for you to learn about some of the issues faced by various patients here in the US. And another important objective is for you to reflect on your personal and professional goals and expand your network. Many alumni continue to stay in touch with each other even after the program ends. And so this is an opportunity to really meet new people and maintain relationships, both with each other, with other participants, and with guest speakers. So let me tell you a little bit about a day of the virtual EHC program. So this is Asia time, but in the morning, we will generally begin with energizers or icebreakers because it's important for the participants to get to know each other and to break the ice so that everyone feels more comfortable sharing ideas and opening up. We will also have some sort of panel discussion or guest speaker presentations and interactive workshops. And then in the late morning or early afternoon, there will be opportunities for discussions in small groups and reflections. And there's a group project component as well that will be completed during the program hours. So you don't need to worry about working on the project outside of the program hours. And then the evenings, there's one small assignment daily, which is to share a written reflection on the day. So during the 7 days of the virtual EHC program, you will learn a lot. And it's important to take the time to take a step back and reflect on what you learned. And so you'll be invited to share about what you learned on our online learning platform, which you will learn more about if you decide to apply and join the program. In terms of who the guest speakers are and topics, we have physicians, including from different disciplines, including family medicine, anesthesiology, gastroenterology, psychiatry, obstetrics, gynecology at Stanford, UCSF, and other hospitals. There will also be opportunities for you to engage with current medical students in the US, including those at Stanford and other medical schools. And you'll also get to meet service providers and beneficiaries. What that means is basically you'll have opportunities to meet with small or big organizations such as Donor Network West, which is an organ procurement organization or OPO that works with families who are looking for organs, along with organ recipients and donor family members. So you'll get to hear directly their stories and experiences. Now, I want to share a little bit about the sample schedule. This is just a sample. So The actual schedule might be a little bit different, but just to give you an idea of what the 7 days could look like, the first day, medical education. So you'll have small group conversations with current medical students and residents from top schools, including Stanford. On day 2, you'll dive into healthcare disparities and response to COVID-19 in the US. COVID-19 will be kind of a lens that we will, or a theme that we will refer to and reflect on. And so you'll hear from professionals who have worked in organizations, including the US Federal Emergency and Management Agency, or FEMA, and learn about their on-the-ground response to the pandemic. Day 3 could be work-life balance among healthcare professionals. This is an opportunity to learn how physicians who work at Stanford, UCSF, and other prestigious hospitals and clinics balance work and life. Day 4 can be a panel discussion on organ transplantation. So this is an opportunity to listen to stories from both organ recipients and donor family members and learn about their experiences with organ transplantation. Day 5 could be on complementary and alternative medicine. So this is an opportunity to engage in discussions with a panel of healthcare professionals who specialize in areas including family medicine, chiropractic, integrative and functional medicine, and acupuncture. Day 6 might focus on mental health, where you'll get to hear from youth who are involved with an organization managed by the Center for Youth Mental Health and Wellbeing at Stanford School of Medicine. And then the final day, day 7, may be palliative and hospice care, where you'll listen to heartwarming stories from staff at Mission Hospice, which is a nonprofit organization, or NPO, that offers palliative and hospice care in the San Francisco Bay Area. So again, this is a sample. So the actual schedule for the spring 2023 EHC program might be a little bit different. But in general, many of the themes will be the same. And I hope you, from the schedule, I hope you see that maybe there are topics that you hadn't ever thought about. And that's one of the goals of the program, is to introduce you to topics and perspectives and ideas that you might not have otherwise engaged with or heard about. So this next slide here is on fellow groups. So fellows play an important role in the program, and we are actually joined today by one former fellow. But just to tell you a little bit about the fellow groups. So each participant will be assigned one of 3 fellows. And in small groups of 3 to 5, led by a fellow, you will have an opportunity to reflect on the day's activities, share ideas, and summarize key insights. Now, in general, we anticipate having anywhere from 10 to 15 participants total. And so these small group discussions led by fellows are an opportunity for you to practice speaking in English, to share ideas in a more intimate setting, because I understand that it can be very intimidating or anxiety-inducing to share in front of a whole group. But in these small groups, you can collect the courage to share ideas and your opinions. You will also get to strengthen your networking skills in the fellow groups by writing follow-up emails to guest speakers and panelists. This is the group project that I referred to briefly a while ago. So this is something you'll do as a group, and you'll learn more about that when you decide to join the program. You will also be able to practice speaking and discussing a variety of topics in English in a small group setting with plenty of support and encouragement. You'll also play icebreakers and games and have fun and build friendships. As I mentioned before, many participants maintain relationships after the program, and so I hope that that's the case for you as well. So now I want to invite the 2 alumni who are here to share a little bit about their experiences. So thank you again to Yuri and Ayaka for being here and for willing to share a little bit about your experience as a participant during the program. So Yuri or Ayaka, who would like to go first?
Ayaka? How about?
Okay.
Or I can go first, or if you don't want to.
Oh, well, either will be fine for me. Yeah.
Also, maybe Ayaka can go first.
Okay.
Okay. Uh, sorry, sorry to delay a little bit.
That's okay. Thank you
Thank
for
you,
being here.
thank you for being here. Um, and for my experience, I participated in the program in this summer, so I'm very new participant, and I'm my major is nursing, so I was a bit worried about joining this program at first, but I jumped in because the director Lena is very kind, and there were opportunities for listening to the presentation and have discussion from people from a wide range of wide range of fields about healthcare. And as a result, I am very happy and satisfied with this program. And as you already seen from the Lena's presentation, the program is well structured, and we were also given a vocabulary cards and other resources related to presentations in the next day. So you can prepare it beforehand, and there are many supports during the programs too. And also, I was able to have discussions with people I wouldn't normally meet in the university life. And when I attend, at that time, there were Myanmar and African medical students there. So I was able to learn about Myanmar and African culture of medicine as well as US, and made many friends there. And after the program, there are alumni events. Yes, and you can continue to keep in touch with friends you made in the program, and also actually, yes, Yuri was my fellow at the time, and we're still keep in touch each other now till now. Yeah, so yeah, I'm very happy and satisfied with this program. So this was my experience. Sorry, was it long or yeah?
No,
Thank you.
thank you so much, Eka. That it means a lot to me that you said those things and that you and Beauty are still in touch. And
Yeah,
I'm very happy that this program meant so much to you. Thank you.
thank you.
And then Yudi, I want
Yeah,
to now give you a chance.
Okay. Actually, Ayaka mentioned so many details about participant experience, so my message is very short. But actually, I joined the EHC program, Spring program, the first online program in 2021, and through the program, of course, that was a great chance for me to improve my English skills. Actually, I've never studied abroad, so I'm not confident about my English. And even still now, I'm still feeling a little bit nervous, but that's okay. And in addition, as Ayaka mentioned, I could learn how different the medical systems are between the United States and Japan, and even other countries like Zambia or Myanmar. And also, I could build up, the relationship with VIA's staff and also other participants. And that relationship has been lasting even still now. And it's a really great thing for me. And so I couldn't mention so many things right now, but if you are interested in this program, I really want to suggest you join this. Even if you are not confident about your English, oh, I couldn't speak English, or I couldn't take interview test. It seems to be really difficult or really serious, but please don't worry about it. During the interview test, Lena will help you to express your thoughts, and also Lena always listen to us very carefully. So please feel relaxed during the interview test. And The problem is whether you can have enough courage to jump in, and I'm really waiting for you to join us. That is my message. Thank you so much.
Thank you so much, Yuri. I love that message, and I love that you use the word courage. And so, just to echo both what Ayaka and Yuri said, and add on it, I am not looking for perfect English. So if you are, nervous about your English ability or nervous about any aspect of the program, as long as you have the right motivation and you're interested in the program, I guarantee that it can be a good fit for you. And of course, if you have any specific questions about any aspects of the program, you can always email me. And before the program, if you do feel nervous about writing to me in English, you can write to me in Japanese and I can respond in Japanese. But during the program, I will only speak in English. So let me go back to sharing my screen and tell you a little bit more about the program. So who is a good fit for this EHC program? So in terms of the requirements of participation, participants are expected to actively participate in all online sessions and contribute to group activities, complete all required activities on the online platform, and communicate in English. And then in terms of interest and attitude, a good fit would be somebody who's interested in learning about healthcare from a variety of perspectives, somebody who wants to explore social issues in the context of healthcare, somebody who's interested in cross-cultural exchange and collaboration, and somebody who wants to embrace the active, brave, curious, open-minded, or ABCO attitude. This ABCO is something that I wholeheartedly embrace and remind participants about every day during the program. I believe that this kind of mindset or attitude is not only useful during the program, but also after. And so especially if you want to step outside of your comfort zone, the EHC program may be a good fit for you. What's not required is perfect English skills. So that's what I was talking about a little bit earlier. We don't have any particular TOEFL score, a minimum score, or anything like that. And you don't need to have international experience. So as Yuri mentioned earlier, she had never studied abroad, but her interest in the program was very clear to me. And so, international experience or travel is not a requirement for the program. So if you are interested in applying, here's the timeline. There are 2 rounds, meaning 2 deadlines. The first one is coming up on December 5th, and then the second deadline is January 30th. There's no really big difference between these 2 deadlines. It's just that if you apply early, then you're more likely to get a spot. But if you're busy right now, then it might be easier to work on the application after the holidays, for example, or during the holidays. And then either way, if you decide to apply by the first or second deadline, you'll have a Zoom interview with me, most likely. And so if you apply by December 5th, the interviews will happen sometime between December 6th and the 10th. And if you apply by the end of January, then the interview timeline will be sometime between January 31st and February 4th. And then if you apply by the first deadline, then results will be shared via email by December 10th and by February 7th if you apply by the January deadline. And then participants are expected to confirm their participation by December 16th or February 10th. The program fee is $900 US. We are able to offer some funding support, which I'll talk a little bit about in the next slide. But essentially what this fee covers are 3-hour, so prior to the program, there will be a support session for anyone who's nervous about their English or nervous about the program content. There will be a 3-hour support session before the program begins. And then during the program, there will be about more than 30 hours of live online presentations, discussions, and interactive workshops. You'll have access to an online learning platform with additional information, resources, and opportunities to connect with peers. You will typically have access to the platform for a while after the program ends. So if you didn't have time to download any resources or slides, you will have time to do that. You will also have mentorship from peers and topic-specific English resources that you can check out on your own, and then opportunities to practice English in the context of healthcare and social issues. For the first time, we are able to offer a program fee reduction anywhere from $100 to $900 from the Enlight Fellowship. So in terms of if you're interested in this, or if you have financial need, the application will have 4 short essay questions, and that's the same regardless of whether you apply for funding. If you require funding, then you'll complete an additional essay question in the application, and successful fellowship applicants will receive an award of anywhere from $100 to $900 towards their program fee. If you have any questions about this, please feel free to let me know. And I wanted to also mention that we do have an in-person program scheduled for next summer in Silicon Valley from August 6th through the 18th. So if those dates work for you, you're also welcome to apply to that. So it's possible to apply to and join both the virtual and in-person program. Of course, the themes of the program for both online and in-person will be similar, but they'll also be different. So if you're interested in both, you're welcome to apply to both. So with that, I wanted to thank you for joining. And if you have any questions right now, you can ask me. But if you don't have any questions right now, you can always email me here at lena@viaprograms.org. And you may email me in English or Japanese.